So Jonathan, let's talk about implementation. Based on the research you've done, how do you see this moving forward?
Well, to sort of piggyback on the discussion David was having, regardless, as he just mentioned, what happens with the Affordable Care Act, or PPACA as the acronym is known, 90% of what we talk about in our book is the reality for the 21st century new health age. What's happening in America, again, regardless of what the policymakers are saying for political reasons, corporate America is driving the change today. And David mentioned one of the key reasons behind that. In America, the average cost for health care insurance per employee is up to $12,000 a year. In America, per American spend $8,000 a year on average for health care. In the 70s, that was about $400 a year per American. So even adjusted for inflation, you can look at that rapid increase in expenditures. We're now in a global economic world that David talks a lot about in his book, The Shift Age. For American companies to compete on a new global marketplace, we can't afford to tack on $1,000 per automobile in America just to pay for health care for the workers that built that. So it's truly corporate America today that's driving it, and they're driving it towards a world of we want to prevent disease for our employees, we want to move towards wellness for our employees, we want to focus on lifestyle change, reduce stress, and really do the things that will help move America out of this era of sickness and towards prevention and wellness, and focus on the chronic disease that's costing us so much money.
So if that's their end game, what are they doing to move their employees and the organizations and insurance companies, and the government for that matter, in that direction?
Well, I like to explain this to always just sort of follow the dollars. And if there are any insurance people in the room, this is my honest opinion, so that you're probably actually going to like this statement. The blame game is over. This is not the insurance company's fault. This is not the government's fault. This is not Americans' fault. The blame game is over. We've got to follow the dollars. And ultimately, the dollars are all of us in the room. Taxpayers, employees, we are ultimately the ones that are paying the cost for health care. So what's going to drive this change is ultimately employers, employees, then followed by the government, putting in place steps and mechanisms to change lifestyle, which will bring down the cost. Carrots and sticks is the approach right now that is sort of being used as a mechanism. For example, take a health assessment test as an employee. Measure your cholesterol, blood pressure, blood sugar levels, etc. Do a measurement, and we'll pay you $50 to $100 for taking that health assessment. Then what that allows the employee to do is motivated to take the health risk assessment. The employer then takes all that data, amasses it, and really develops a benefit plan around where all their costs are. And every company is different. Starbucks, for example, went through this exercise and found out that one of their largest areas of expense for healthcare were orthopedic problems. They didn't know that until they went through this process. Once they discovered that orthopedics were our primary cause for our healthcare insurance increases, they developed an employee benefit plan around orthopedic problems, physical therapy, massage therapy, et cetera, et cetera. So motivating employees to go through this process actually through payments and other bonus type programs is the way to get them engaged. And then long term, you've got to wrap around incentives, carrots and sticks to keep them engaged.
And what we know is that 70% of all healthcare costs in the United States are incurred by 10% of the population. And these are the ones that have the comorbidities because they're obese, they have diabetes or high blood pressure or heart disease. So if you can cut that by 10%, right? So the 10% of the population has 70% of the cost. You cut that down to 9%, you've saved 7%. So it's all known, it's all knowledge. If there are employers who are saying, okay, you're 50 pounds overweight, we're going to give you a personal trainer, we're going to give you monthly assessment, and we're going to give you $1,000 in a year if you lose that 50 pounds. And if the response is, well, I don't want anybody to tell me what to do, okay, great, you're going to pay $200 more for your health care because that's what the risk says, your call. So it's going to become much more, as Jonathan said, carrot and sticks, based on your health profile. Like at Boeing, for example, we're going to pay people $50 to do an online health assessment to better manage their health care. When that didn't happen, they said, okay, if you don't do that, we're going to charge you $25 a month more for your health care coverage. Your choice. So that's how the companies are going to become self-funding, if you will, and they're going to align initially, at least with insurance companies, to figure that out. In Boeing's case, they drove down healthcare costs by 25% in 3 years.
But for the business people in the room, especially the CEOs, CFOs, and leaders of the organizations, David's absolutely right. And in my earlier point, when I said follow the money, that's critically important. All that said, this is about lifestyle change, making America healthier, empowering people to feel better about themselves through these changes. And for businesses that are moving in this direction, the worst thing you can do is January 1 announce something like, we're implementing this employee wellness program so that we can become 10% more profitable and the shareholders will love us and the CEOs and the corporations are going to get all these big bonuses. And ultimately, it is an economic decision, as I said, and it's an economic issue. But the wonderful thing about the new health age is that we are truly going to become happier, healthier, more balanced people, mind, body, spirit, as the most important benefit of the whole era.